Okay. Hi, my name is Allison Waters. I'm doing my head-to-toe assessment for adult health in fall of 2024 semester. This is my patient. For this exam, when I normally would be listening for like a full 60 seconds, for the sake of time, we'll kind of be breezing through things. So I'm going to scan my room really quick. This is where I'm going to have my phone set up, the walls. Here's my table with all of my things, ceiling, floor. All right, setting my phone back up, make sure I can see. Perfect. Okay. So I'm going to be doing the skin assessment throughout the exam. I'll be examining the skin for turgor, temperature, color, texture, edema, bruising, scars, lesions, or nevi. Starting with the head, I'm going to inspect for size, shape, and symmetry, midline position. I'm going to palpate for hair distribution, hair color, hair texture, assess for any lesions, masses, depressions, or infestations. I'm going to palpate the temporal arteries for tenderness. And then I'm going to palpate the lymph nodes. So preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, I'll palpate TMJ for any tenderness or subluxation. So I want you to clench your jaw. Good job. Cranial nerve number 5 is trigeminal. For motor, I'll palpate over the masseter muscle while my patient clenches their jaw. Awesome. And for light touch sensation, I want you to close your eyes and tell me where you feel this on your face.
Forehead, cheek.
Awesome. All right. Cranial nerve number 7 is faces, so I want you to smile, frown, raise your eyebrows, puff your cheeks, and pucker your lips. Awesome. So I'll inspect the ear for any abnormalities or deformities. I'm going to palpate the pinna and the tragus for tenderness and masses. I'm going to get my otoscope. And I'm going to inspect the auditory ear canal by pulling the pinna up and back. Tympanic membrane is a pearly gray. Same thing on the other side. Pinna up and back. Tympanic membrane is a pearly gray. Keep this in my pocket. Cranial nerve number 8 is vestibular cochlear. So this is to assess hearing. So I'm going to stand behind my patient and we'll do the whisper test. So repeat after me.
1, 2, 3. ABC.
All right, next we'll do the Weber test to test for lateralization. I'll activate my tuning fork and place it on your head. Do you hear it on the both sides?
Yes.
Awesome. The Rhine test is where I'll activate my tuning fork, place it over the mastoid bone, so tell me when you can't hear it.
I can't hear it.
Do you hear it now?
Yes.
Awesome. Do it on the other side. Tell me you can't hear it.
I can't hear it.
You hear it now?
Yes.
Awesome, great. Air conduction is greater than bone conduction. And next, I'm gonna move on to the eyes where I'll inspect the lashes, brows, palpebral fissures for any abnormalities. I'll inspect the sclera and conjunctiva for color, lesions, and discharge. Cranial nerve number 2 is optic. So we'll assess gross visual acuity. Normally this would be 6 feet away from the patient. So I'm going to have you cover one eye, and I want you to read the lowest line that you can.
LTFPH.
Awesome. And cover your other eye.
LTFPH.
All right. And uncover and read.
LTFPH.
Awesome. Her visual acuity is 20/20. Next, I'm going to have you cover, have you cover one eye and follow my fingers. I'm going to cover the opposite eye. Awesome. All visual fields. Perfect. Next is cranial nerve number 3, which is oculomotor. This tests for direct consensual pupillary response to light. So look just straight at my nose. Awesome. All right, pupils constrict evenly. We'll test for accommodation and convergence. So I want you to look at my finger and follow it in. Good job. Cranial nerves number 3, 4, and 6 are oculomotor, trochlear, and abducens. So I want you to face me and follow my finger to all visual fields. Awesome. Next we'll be doing, I'll use the ophthalmoscope to do the red light reflex. So from about an arm's length away from my patient, I will find that red reflex and follow it in. Excellent. No spots or nicking noted. Same thing over here. Follow it in. No spots or nicking noted. Next, I'm going to inspect the nose. I'm going to see that the nose is midline and straight. Cranial number 1 is olfactory. So this is to assess smell. So I'm going to take this alcohol pack. I want you to close your eyes and tell me what you smell.
Alcohol.
Good job. And next I'm going to assess for nasal patency. So I want you to cover one nostril, breathe in and out. Awesome. Next, breathe in and out. Good job. I'm going to palpate her maxillary and frontal sinuses for any tenderness, abnormalities. That's all good. Next I'm going to take my light source. I'm going to look in your throat and mouth. Say "ah" for me. I see that the uvula rises and soft palate rises and falls with phonation. Cranial nerve number 9 and 10 is glossopharyngeal and vagus, and that is intact with the saying "ah." Can you stick your tongue out? Awesome. Cranial nerve number 12 is hypoglossal, and we see that the tongue is midline without fasciculations. Also, when I was looking in her mouth, I was assessing for the salivary glands. I was looking at the tongue, teeth, buccal mucosa, etc. All that looked good. Next, I'm going to palpate the trachea to see that it's midline. And it is. Next, moving on to the thyroid gland, I'm going to stand behind my patient. I'm going to gently displace it with one hand while she swallows. I'll palpate on the other side. Perfect. Same thing, gently displace and swallow. Good job. I'm going to palpate the carotid pulses one side at a time using the pads of my fingers. Not pressing too hard. Good job, that's 2+. And then using the bell of my stethoscope, I'm going to assess for any carotid bruits. Take a deep breath in. Hold it. Okay, you can breathe. Deep breath in. Hold it. Breathe. Awesome. All right, moving on to her posterior chest. We're going to have you turn around. First, I'm assessing for any signs of respiratory distress. That would be cyanosis, retractions, tachypnea, accessory muscle use. I'm going to inspect for any signs of deformity and symmetry. I'm palpate for symmetrical chest expansion at the 7th rib. Take a deep breath in. Good job. All right. Then I'm going to palpate for tactile fremitus. So when you feel my hands, I want you to say 99.
99, 99, 99, 99.
Good job. I'm going to percuss over the posterior lung fields. Perfect. Now I auscultate using the diaphragm of my stethoscope, starting at the scapula and moving down, making sure I get both sides. Perfect. Next we'll test for agophony. So whenever you feel my stethoscope on your back, I want you to say E.
E, 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 E.
Awesome. Next will be bronchophony. So whenever you feel my stethoscope, I want you to say 99.
99, 99, 99, 99, 99, 99.
Next, whisper pectoriloquy. I want you to say whisper 1, 2, 3 whenever you feel my stethoscope. 1, 2, 3. 1, 2, 3. Awesome, good job. So you can turn around. Now I'm going to inspect the anterior chest for any deformities, symmetry. I'm going to palpate chest expansion again. Take a deep breath in. Good job. And I will palpate for tactile fremitus. So say 99.
99, 99, 99.
Good job. Moving on to auscultation, I will auscultate the anterior lung fields, also using the diaphragm of my stethoscope. Awesome. All right, so I will then move on to cardiac, and I'll listen to the 5 cardiac points using the bell and the diaphragm of my stethoscope. So aortic, pulmonic, herbs, tricuspid, mitral, using the bell, aortic, pulmonic, herbs, tricuspid, mitral. And next I'm going to inspect and palpate for the PMI, which is close to where the mitral sound can be heard, which is right here. I would listen for 60 seconds and see that her heart rate is 70 beats per minute with a regular rhythm. Now we're going to lay down. Move this out of the way, make sure that you can still see in the camera. Yes, okay. So while I have her laying down, I'm assessing for jugular vein distension, jugular pulsations. I'm assessing for the chest for any heaves or lifts. I'm going to palpate for thrills over each auscultation point. So aortic, pulmonic, herbs, tricuspid, mitral. Then I'm going to also auscultate with her laying down. Aortic, pulmonic, herbs, tricuspid, mitral with the bell, aortic, pulmonic, herbs, tricuspid, mitral. Next, I'm going to inspect the abdomen for contour and symmetry. I'm going to inspect for any deformities. I'm going to auscultate for any abdominal bruise using the diaphragm, aortic, renal arteries, iliac arteries, and femoral arteries. All right. Next, I'm going to listen and auscultate for the 4 quadrants. And I see that she has normal active bowel sounds in all 4 quadrants. I'm going to palpate or percuss in all 4 quadrants for any tenderness, flatness, or dullness. I'm going to palpate now and see if there are any tenderness or masses. And she's good. All right, so now I'm going to have you come stand back up. I want you to turn around and back facing the camera. I'm going to have you lean over a little bit. I'll percuss for CVA tenderness. Awesome, you can stand up. Let me get your seat back. Make sure this is in here. Starting with the upper extremities, I'm going to inspect and palpate the joints of the hands and the wrists, the elbows, shoulders, making sure there's not any tenderness, swelling, deformities, nodules, crepitus, and symmetry. I'm going to palpate capillary refill in both of her hands and radial pulses. 2+. Next, we're going to do range of motion with your fingers. So I want you to follow along with what I'm doing. So flexion, extension, hyperextension, abduction, adduction, thumb opposition. Awesome. For your wrist, we'll do flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. For elbows, we'll do flexion, extension, hyperextension. For shoulders, flexion, extension, hyperextension, external and internal rotation. abduction, adduction, circumduction. Good job. Next rule, it says hand strength, so I want you to grip my hands. 5 out of 5 hand strength. Will assess the strength of your biceps and triceps, so I want you to push out against my hands. Go like this. Push out. Good. Pull up. 5 out of 5 strength for biceps and triceps. For your shoulders, I want you to push out against my hands, and against my hands. 5 out of 5 strength for abduction and adduction of the shoulders. Cranial nerve number 11 is accessory. So I'm going to come behind my patient, shrug your shoulders. Perfect. We'll move on to assess cerebellar function, including rapid alternating movements versus serial finger opposition. Nice. And then we'll do hand flip-flops. And then finger to finger, so I want you to touch your nose and touch my finger. Kind of missed there. Good job. Next, I want you to keep your palms up and close your eyes. We're going to do stereogenesis. So I want you to keep your palms up. Tell me what is in your right hand and your left hand.
Right hand is a coin, left hand is a screw.
Perfect. All right, next is graphesthesia. So have your palms up again and close your eyes. I want you to tell me what I'm writing in your hand.
A. 2.
Nice. We'll move on, and I'm going to assess the warmth, skin integrity, color, temperature, texture of all extremities. We'll assess for light touch sensations. So close your eyes again. Tell me where you feel the light touch.
On my knee, thumb, top of my hand.
Nice. All right. Next, we'll assess for vibratory sensation. So I'm going to take my tuning fork and place it over the proximal ulnar prominence. Perfect. And I want you to tell me, I'm going to activate it and tell me if you can feel it.
Yes. Yes.
Awesome. Then I'll go down to the ankles and activate it and put it on the medial malleolus. Do you feel it?
Yes.
You feel it?
Yes.
Awesome. Next we'll do deep tendon reflexes. So patellar, have your feet hanging. Good job. Awesome. Next is Achilles, so I'm going to kind of have your foot rested on my hand. Good job. Same thing. And Babinski, tickles a little bit. Sorry. All right, next I'm going to inspect and palpate her toes, legs for any tenderness, swelling, edema, crepitus, symmetry. I'll assess for capillary refill in her toes and assess dorsalis pedis and posterior tibial pulses, which are 2+. Range of motion with your toes, so I want you to follow along with what I'm doing with my fingers with your toes. Make sure, let's see. There we go. All right, so flexion, extension, hyperextension, abduction, adduction. For your ankles, I want you to do dorsiflexion, plantar flexion, inversion, eversion, rotation. All right. Assessing the strength of your ankles, I want you to push down on my hands, push up. Awesome. 5 out of 5 strength for the ankles. For your knees, push out, pull back. 5 out of 5 strength for her knees. And then for your hips, push out and pull in. 5 out of 5 strength for abduction and adduction of the hips. So go ahead and stand up. We're going to assess for range of motion at the hips. So I want you to follow after me. Flexion, extension, hyperextension, abduction, adduction, internal rotation and external rotation, circumduction. All right, now next side. Flexion, extension, hyperextension, kicking the wall, internal and external rotation, circumduction, and then I forgot abduction and adduction. Good job. For the knees, we'll do flexion, extension, hyperextension. Other one, flexion, extension, hyperextension. Perfect. All right, so have your back facing the camera, and I want you to kind of bend over. So looking at her spine, I'm gonna assess for scoliosis, tenderness, deformities, and that all looks good. You can stand back up. Next, we'll assess for range of motion of your lumbar spine. So we'll do flexion, extension, hyperextension, lateral flexion, and rotation. Next, cervical spine, flexion, extension, hyperextension, lateral flexion, and rotation. Perfect. For the Romberg test, I want you to close your eyes with her feet together. Stand by her side. If she doesn't sway or lose her balance for 30 seconds, this is a negative Romberg test. Next, we're going to assess your gait. So I'm going to move this out of the way. And walk there and walk back. Perfect. Awesome. Now I want you to start back here and we'll do heel to toe walking, where you just kind of go heel to toe. Good job. Now I want you to hop on one foot, hop on the other, and we're done.